And good morning. It is now September 9, 2025. Our patient presents here from Utah. She has had back pain now for, well, it's been more than a year, but it's been out of control for about a year. And she is wheelchair bound. What that means is she can't get out of the wheelchair since February. Sean? So she's been in a wheelchair since February in horrible pain. She's gained a lot of weight because of her back pain. Sean? She can't have a normal life. She has pain coming from more than one location. As a matter of fact, her pain is coming from 2 discs plus her piriformis muscles on both sides plus her sacroiliac joints, Sean, on both sides. So we're going to fix her 2 discs first, Sean. Then we're going to, this light is like right in my eye. I can't see the screen. Okay? Yeah, it's better. We're going to fix her 2 discs first on both sides, and we're going to do her piriformis and SI joints. All right. We have an issue. Obviously, she's overweight. And that makes the surgery much more difficult for me to do, Sean, because all that extra soft tissue makes it very difficult to see our needle, AP, on the lateral view, because the x-rays have to penetrate more soft tissue, more skin, more fat, more muscle with heavy-set patients. It looks perfect. We got lucky there. So some patients, the spine itself is very far back towards us, and other patients it's very far towards the ground, on the floor. In her case, thank God, it's not too far towards the floor. Otherwise, this surgery would be a lot more difficult to do. Sean? So we're inside the disc at 4-5, Sean. How far in are we, AP? I'm going to place a guide wire. And then, yeah, we're in good. That's good, actually. Very happy with that. We're going to place the guide wire, and then I'm going to take the needle out, and that's going to give me enough room to place the second needle, shot, which needs to go in, because we're putting one needle in at L4-5 and one at L3-4. Now let's see if I can make it through the same incision.
Do you want a longer one?
No, this should be fine. If you have questions, feel free to ask me. You're watching live spine surgery from the Duke Spine Institute. And as I said earlier, our patient has had chronic back pain. She's now in a wheelchair. She cannot get out of the wheelchair. She has too much pain. She literally stands for just a few seconds, and then she has to sit back down. Her pain is so severe. Her quality of life has been stolen from her. She's here with her brother and sister, who are going to be taking care of her after surgery. And Sean? Nice people. They're from Utah. Let's just see what we've got here. AP? Perfect. So far, so good. Remember, we're treating L4-5 and L3-4. L3-4, L4-5. All right. That looks pretty good. Sean? Sean? All right. So we are good on the patient's left side. Now I'm going to move over to the right side and do the same thing. Any questions?
Yes, we have a
Sean?
few questions. This first one is coming from Lanu on YouTube.
Hi, Lanu.
Asking an economic question. I know the economics is not related
Sean?
to the medical field, but has the economy affected your medical business this year?
Sean? Yes. Yeah, the economy always affects our business because many of our patients have to pay money out of their pocket, and when the economy's bad, people have less money to spend on healthcare, which they shouldn't have to spend on. They should not have to pay out of pocket for these surgeries. These surgeries are curative surgeries, and they should be covered by insurance. We all know that the insurance companies have billions and billions and billions of dollars of extra money available to take care of patients, which they choose not to spend on patients, unfortunately. They choose to keep it as profits. Shot? It's so hard to see that needle there, Jordan. I'm wondering if you can't help me see it a little better. I know the disc space is collapsed. Shot? That's a little better. I'm a little concerned about the one above, but I think we're okay. All right, well, I'm kind of right at the back of the disc here with this guy, and I can't get in any better than I am. So let's get an AP and see where we are. Come on. You gave it here?
Yeah.
Oh, okay, good. All right, looks good. Looks good. Perfect. Now our needle is right there. You can see it at the back of the disc. It just doesn't want to go in because the disc is so collapsed. That said, I'm happy with its position. We should be able to get in quite nicely. Yep, so definitely the economy has an effect. Remember, our patients come from all over the world, and it turns out that when the United States economy suffers, so does other countries typically have trouble as well, because everything is based on the US dollar. China is trying to change that. They want everything based on their currency instead. And they may succeed. But that said, right now, most people still, the dollar is the sort of international gold standard. So when the United States economy suffers, every economy does suffer. Shot? All right. AP. So we're in on both discs on both sides. We've gotten in with the needles as we've gone transforaminal. We're not cutting any muscle. We're not removing any bone. We're going in through a natural opening on both sides of the spine. And our patient is, because of her morbid obesity, she's over 350 pounds. We cannot safely do the surgery without her being intubated. So we decided to put her intubated for her safety and keep her on a ventilator. So that makes her respiratory safety issues much better and cardiovascular issues much better. But we're still going to do a discogram. Shot? Holy macaroni. Shot? Yeah, you can see the tear in the back of the disc. I don't think that's... All right. Yeah, this one is not all the way in, remember? But I think it's filling the disc. So yeah, it went in, look. Good. Any questions from our audience? We're going to get started, if not.
Yes.
And I think, actually, before we take questions, why don't we show the audience the 30 different things that cause back pain.
Of course.
I'm Dr. R. Duke Majin with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majin. Thanks for joining us. Welcome back. You can see from our video there are 30 specific causes of chronic lower back pain. Chronic lower back pain is basically the back pain everybody has. Chronic just means you have it for more than 2 weeks, and everybody that we talk to here at Duke Spine has had back pain for usually months or years. Chronic lower back pain has very specific causes, and Duke Spine Institute is the first in the world to identify all the causes of chronic lower back pain, and more importantly, we also have developed the first pioneering treatments. These treatments are all patented, every single one of them, and they are not performed pretty much anywhere else yet. Now, just like any other patented technology, it can be shared, it can be taught, just like drugs that are patented, right? We still use drugs even though they're patented. And people benefit from patented medical technology. Well, people can benefit from our patented medical technology. The reason it's patented is very simple: quality control. I don't want just any doctor putting out in their window a little sign that says, we're doing the Duke laser disc repair here, so that people will say, oh, I'll just go there for it, and they end up going somewhere where they can get hurt by the doctor who's not trained properly or not qualified to do this treatment. So the patenting is really about quality control, and it establishes who the founder is, the patent creator. That's me, Dr. Ara Duke-Majan. I am the patent creator. I'm the one who came up with the idea and patented it. So, that said, what's important is that not only do we understand all the causes of back pain and neck pain, but we also have cures for 99% of them. Okay, 99% have cures. And that's what's most important for patients, because people don't want to live anymore with back and neck pain when it's something that can be cured. I just had a conversation with a patient this morning who is out of state, and he is in another state. He's trying to get relief of his horrible pain. And of course, what do the doctors do? They can't cure his pain. So all they do is shots, shots, shots. And the shots may give him some temporary partial relief, but the pain always comes back. And that's the problem with pain management, folks. Pain management doctors do not know how to cure pain. They're not capable of curing pain. They don't have the technology. They don't have the training. They don't have the ability. They're not able to do the procedures that cure pain. Yet all they can do is treatments that may give you some temporary relief of pain, but the pain always comes back. Now, this patient has two problems. She has severe back pain, severe, like she can't even walk. Her pain is so bad she has to sit in a wheelchair. How tall is she? She's 5'10", but she weighs over 350 pounds, right? Sorry, 320? 328. Oh my God, I feel horrible. She's gonna hate me. All right, I said over 350, but it's really 330. Okay, so please don't hate me for saying that your weight was 350, okay? She's gonna watch the surgery tomorrow and she's gonna be upset with me. You know how it is. So I apologize for overstating her weight. She's got 330 pounds and she's, 5'10". So she's obese, okay? And people think wrongly that fat people are the ones with back pain. It's not fat people that have back pain. People get fat because they have back pain. You see, when you're having so much pain every day with activity, you don't want to do anything. You don't want to get out of your wheelchair to exercise because your back hurts. So what happens is people with back pain end up getting fat. We have thousands of patients we've treated that are skinny. Okay, these are skinny people. There's a piece of herniation right there. You guys see that?
Yes, we do.
That is a nice one. Let's take a look at this real quick. I know we've got a lot of surgery ahead of us, but I'm going to show it to you anyway. You guys see this? That's one piece of herniation right there.
Yes, we do.
All right, that thing is about 2/3 of an inch. Okay, but we're going to take out about 20 of those per disc, and once we get all 20 of them out, this disc will heal properly, and the patient will be pain-free. All right, let's take some questions, and then I'm going to show you how the Duke laser disc repair works.
Next question coming from Mike on YouTube, asking, does this patient have lumbar spinal stenosis at those areas?
Yes, Mike, you are correct. This patient has lumbar spinal stenosis, which means narrowing. Earlier I told you that she has two problems. The first is back pain. The second is weakness in her legs because her nerves are being pinched at L3-4 and L4-5 on both sides. That's why we're doing the Duke laser disc repair. Her back pain is primarily coming from her piriformis muscles and her sacroiliac joint. Her leg weakness, numbness, and tingling, we call it neurogenic claudication, when she's standing and walking, is coming from the stenosis. Now, her stenosis is called lateral recess stenosis because it's not central, it's off in the lateral recess. The lateral recess is the space underneath the facet joint, and that's caused by the herniation, the disc herniation. So her stenosis is actually caused by the bulging and herniated discs that are pushing out and narrowing the lateral recess. You guys can see all the herniation we've taken out so far, and it's pretty much gone at this side. I still have the other side to do. You can see the needle on the other side. That's our marker for the opposite side. So we are going to go and do the other side soon, but I got to get as much herniation out from this side as I can. But notice how the needles can actually meet in the middle.
We can see.
All right, let's take some more questions, and if there are none, we will show our audience why this surgery, how this surgery works to get rid of back pain, and then we'll show them why is the Duke laser disc repair the best treatment in the world for back pain.
This next comment is coming from Scott on LinkedIn.
Scott?
Saying, this lady will feel like a bionic woman when you are done with her.
Scott.
I wonder in the future, once we are off-world, if there will be less disc issues or easier ways to address due to lack of gravity.
Well, Scott, it's a great question. I don't know the answer, obviously, but, you know, theoretically, you're probably right. On the other hand, off-world, there are forces too, right? Like liftoff and touchdown, and there could be trauma as well. Remember, it's not gravity that's created all these problems. It's actually, gravity is sort of the witness. It's more trauma, spine trauma. Any kind of trauma to the spine is what's causing disc injuries. So that can be, as you said, a gravity-related trauma, such as a slip and fall. But an impact by a car in a car accident is not so much gravity-related. It's more mass times acceleration, but in a linear fashion rather than a vertical fashion. So anyway, good thought, and I appreciate the sentiment. We love our people who wish us well and are happy with what we're doing here, besides our patients. So thank you. All right, I'm just about done with this disc. I need about 30 seconds, and then I'm going to move on to the next on this side, which is going to be the L4-5. I've gotten out as many pieces of herniation as I can get, and that's another piece right there. Thank you, Luis. Luis is doing an amazing job of assisting me today. Take that. But you can see the fibers of the posterior ligament and the epidural fat right there, so we're done. And I've decompressed the lateral recess here. We're gonna basically take this out. What was the sugar this morning? So we're gonna probably avoid the use of anything that would raise sugar. We're just gonna do some antibiotics. Any other questions before we show you how the Duke laser disc repair cures back pain and how back pain occurs from disc injuries?
Yes, this next question coming from Lanu once more on YouTube, asking, does this patient also have herniations on her neck? Just curious.
Great question. So Lanu is asking, this poor woman has lower back herniations. Does she also have neck herniations? And the reason Lanu is asking that is because she remembers what I said several weeks ago, which is that patients with disc herniations in their lower back that are symptomatic also have cervical disc herniations that are symptomatic in 66% of the cases, which is 2/3. So 2/3 of patients with herniated discs in their lower back also have herniated discs in their neck that are causing symptoms. Remember, if you want to know what percentage of people have herniated discs, it's about 95% of people over the age of 45. Okay? 95% of people over the age of 45 have herniated discs in their body. But 90% of those patients have no symptoms. Therefore, they require no treatment. It's only patients that have symptoms that require treatment. Only patients with symptoms from the herniated disc that require treatment. I can't see, Sean. All right, folks, we're going in to disc number 2. I'll do all this. You just put pressure. All right. So, Henry, why don't you share with the audience how disc injuries like herniated disc or degenerated disc, either in the back or neck, how they cause so much pain for people, like back pain. And then we'll show you how we fix it with our laser surgery.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Well, welcome back. Henry has just shown you why disc injuries cause so much back pain. It's a tear in the back of the disc called the annular tear. That was discovered here at Duke Spine Institute by me by performing laser surgery on those tears and realizing that the pain went away. And that's when I realized the pathophysiology of discogenic back pain, which is basically inflammation happening within the posterior annular tear as a result of a herniated nucleus pulposus causing a reactive inflammatory response within the annular tear, which is vascularized, by the way, and brings in new nerve fibers called neoneurulation and new blood vessels called neovascularization. That whole process was elucidated by myself, Dr. Duke Majan here at Duke Spine, and we have been treating it now for 20 years. And we've been trying to teach the rest of the world. I've gone to the biggest neurosurgery spine meetings in the world, the biggest meetings for spine surgeons, the most important meetings for spine surgeons. I've published in the medical journals. I've given lectures at the most important meetings, presented my peer-reviewed data at these meetings, and still have a very, very poor response from organized spine surgery around the world because unfortunately the spine surgeons all want to do fusions. They don't want to change what they're doing. Fusions and artificial disc surgery and pain management pays doctors millions of dollars a year in commissions and salaries. Unfortunately, when you fix somebody's back pain, they stop becoming your patient. They go away and you never see them again. And what happens then is you lose a lot of money. So doctors really aren't interested in curing people's pain like Duke Spine Institute is. They just want to manage pain and treat it. and get paid for it and then keep patients in pain, right? It reminds me of these tribes in Africa. You know, these tribes in Africa that have cattle, and cattle are sacred to them. And instead of eating the cow, they actually take the cow's milk and they stick a knife in the neck and they bleed the cow into a cup. And they mix the milk and the blood together and they drink it. And that's how they live. They live as a parasite off of the cow, right? A human parasite eating the cow, but the cow then makes its blood back and it makes its milk back. So it's a sustainable relationship between human and cow, right? And the cow doesn't die, and the humans don't die, and they take these herds of cows along with them as they're nomadic people. They migrate and they bring their grazing cows around Africa to where the grass is, and they live off these cows. And it's actually quite brilliant, but that's how pain management is, and that's how spine surgeons are. They basically don't kill their patients. They just live off them by bleeding them. And unfortunately, in the end, the cows are still prisoners, and they still have a miserable existence of being bled and drank throughout their life until somebody gets a hankering for hamburgers. Anyway, pretty interesting stuff. Henry, have we shown the audience how we cure back pain with our Duke laser disc repair?
Of course.
You did?
That we did, yes.
All right. So then let's show our audience why this surgery they're watching is truly the very best treatment for discogenic back pain, which is the most common cause of back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Hi, I'm Dr. Duke Machen. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, you, there is no need for postoperative opioids. Our patients are treated with a small 7-millimeter incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, sorry about the glitch on the video, but you've all seen it. A comparison of Duke laser disc repair, what we're doing today for this young lady, versus all these other treatments that doctors are recommending for patients today that are highly invasive. I predict those treatments will all be gone someday in the future when we get smarter about healthcare and decide as a country we don't want to waste money on healthcare and we want to give patients the right treatment, which is the Duke laser disc repair. None of those treatments that are offered, spinal fusion, artificial disc, laminectomy, discectomy, mild procedure, spinal cord stimulator, none of them are curative of back pain. None of them. They are not curative procedures. They create more problems most often for patients. They create new problems. We call those complications. And they are very invasive procedures. All right, for those of you, I think it was Scott, was asking about, does this patient have stenosis? See this right here, Scott? That is the cause of the stenosis. It is a herniation sticking out, but it's not just herniation. It's got scar tissue in it. I apologize for the view, but you can see the yellow stuff is calcium deposits. You don't get calcium deposits in a disc herniation overnight. That takes years of herniation, years of inflammation to make those calcium deposits, and they are hard. They're not the only hard thing in there. The other hard thing in there is scar tissue. So you got scar tissue, you got calcium deposits, you've got herniated nucleus, which is all collagenized, we call it, or scarred up. And then you got all those pain nerve fibers we talked about in the video. So those other surgeries you watch they don't fix back pain at all because they don't address the root cause of back pain. The root cause of back pain in the disc is the inflammation happening right here at the back of the disc. You can actually see it. It's all the red stuff, pinkish stuff. I apologize again because there's some blood. That's what's making the view not great. And there's blood because we already did the opposite side. So the blood is coming through the disc and into our field, what we call our field, our surgical field. And that's why it's obscuring your view. Thank God I've done a couple of these already, so I know what I'm doing. I don't have to have perfectly good vision. Okay, it's kind of like a Formula One driver driving in the rain. I'm driving in the blood. Any questions?
Yes, we have a lot of questions and comments. This next one is coming from Mike, once more on YouTube, saying, I have the same problem with annular tears on my left. I'm trying to get L3-L4 and L4-L5 surgery on Thursday. Does the L5 nerve root exit at L4 to L5? Thank you.
Great question. Does the L5 nerve root exit at L4, L5? No. The L4 nerve root exits at L4, 5. The L5 nerve root passes by and waves hello as it's passing the disc in what's called the lateral recess. But the L4 nerve root's going to be in the foramen. Good question. All right, we are done here, and I'm going to move on to the last disc that we need to do. That's going to be the L3-4, but I've got to replace the scope off. I got to replace the needle because the needle came out, and actually it got welded from the other side. I must have hit it with a laser. I didn't even see the needle, but I must have hit it with a laser. It welded the inside. It melted basically the needle, and now I can't put a guide wire in there, so I'm going to have to put the needle back in. Okay. All right, tube's coming out. Other needles coming out. Just check it. We're going to place a new needle, but I need fluoro in before I do that. Any questions?
Yes, this next question is coming from Poodle Dog on YouTube.
Poodle dog. I love poodle dogs. Go ahead.
Asking, are you using propofol or straight anesthesia on this person, and how long is this surgery? Also, I love watching your surgeries. You are amazing. God bless you with much wisdom.
Well, God bless you too. So we are using on this patient in particular, unlike every other patient we do, which is lumbar, we're using general anesthesia. She's tubed. She's on the ventilator. We're not taking any chances. She's morbidly obese, meaning she's got a lot of extra weight on, and we cannot risk a long surgery like hers causing her to stop breathing. Jordan, I really need your help here. We're worried about something called respiratory fatigue, Dr. Berndes chimed in. And what that means, simply put, in English, is that we're worried she's going to get tired and stop breathing. Shot? All right. And it's a real concern, by the way, with these types of surgeries, especially the longer surgeries, which hers is a longer surgery. Hers is longer because we're doing 4 levels, shot, and more importantly, we are also doing her piriformis and SI. Shot? We're in like Flynn. So, before I take any more questions, you all know I'm a big movie guy, 80s, 90s. The real movies, the good movies that were made here in America during the 80s, 70s, 80s, and 90s are truly the best movies that were ever made. And then our movie studios just went to garbage. And I was watching an old movie with Kevin Spacey. I was telling one of my patients about it yesterday. She's a mental health, behavioral health expert. She was here for a problem with her neck and her back, both. And she and I were chatting about the movie. It's called K-Pax, K-P-A-X, Kevin Spacey. I watched it 3 times. I watched it 2 nights ago, and I love that movie. It's such a good movie. If you ever get a chance, I highly recommend it. K-Pax, Kevin Spacey, one of the best actors from the 80s, 90s. Yeah. Great, great movie. I'm not going to talk too much about it in case you want to go watch it, but phenomenal movie about a mental health patient, and just so many great messages in that movie. Highly recommend it. Great movie. K-Pax, Kevin Spacey, one of the best actors of our generation. He's old now. All right. Any other questions?
Yes, we have a question coming from Pavel on YouTube.
Pavel, welcome.
Asking, hi, Dr. Duke. It's great to watch you perform these live back surgeries. In your opinion, after microdiscectomy, can the patient get leg cramps?
Can the patient get leg cramps after microdiscectomy?
Correct.
So the answer is yes, if it's not done properly. But a patient who has the proper treatment should not have leg cramps. They should not have leg cramps. Microdiscectomy is not a good procedure, as you all know. I'm against it because the surgeon has to, number one, remove bone and ligaments out of your spine, and that causes the spine to wobble and move in ways it's not supposed to, okay? And that can cause pressure on the nerves nearby behind the disc. Because remember, if you look at your nerve, it's coming out at the foramen. The front of the foramen is the herniated disc. The back of the foramen is the facet joint. The top of the foramen is a pedicle, which you can't do anything about, and the bottom of the foramen is a pedicle. So you got a pedicle above, a pedicle below, which are immovable objects. They're like marble columns. They don't move. So the only way to make your foramen bigger is to either remove the herniation that's pinching the nerve from the front, which is the best treatment. That's what Duke laser disc repair does. That's what we're doing right now. But we do it without removing any of the bones and ligaments that weaken the spine. Another option is to remove the facet joint in the back. Removing the facet joint weakens your spine. It's like taking half of your knee joint away. You got the other half still there, but it's going to start wobbling around, and over the next couple of years, your knee is going to fall apart. Well, your spine falls apart after a microdiscectomy. And it depends on how much of the facet joint the surgeon takes away. But most surgeons take 50% of the facet joint away. Many surgeons now are taking more than 50, they're taking 100. I used to take 100 and I would fuse. And that's why my patients did so well. They didn't get leg cramps afterwards. Our patients don't get leg cramps. Your leg cramps could be a result of bad surgery where you're going to need another surgery, and we can do it for you at Duke Spine. Or it could be a result of the fact that you have a vascular problem, like a vein problem. For example, we call it venous stasis disease. Look it up. Venous, V-E-N-O-U-S, stasis, S-T-A-S-I-S, disease, with venous hypertension in your legs. That could definitely cause it. Another could be metabolic electrolyte imbalances, like calcium, magnesium, aluminum abnormalities, where you start getting muscle cramps as a result. Another could be the side effects of a medication that you're taking. For example, certain anti-cholesterol or cholesterol lowering. God damn it, this piece of herniation is just not leaving. Cholesterol lowering medication or lipid lowering medications can cause cramping. So there's a whole bunch of medicines that cause cramping, electrolyte disturbances that cause cramping, improperly performed decompression of the nerve root that causes cramping, and there's other syndromes like piriformis syndrome that would cause cramping. Okay? So there's a whole bunch of different possible causes. What is your cause? I have no idea. I would have to examine you. I would have to do a physical exam, maybe run a few tests, do a nerve test too, to figure it out. But it can be figured out at Duke Spine. I doubt your doctor is going to figure it out, but they may figure it out if they get really lucky. Remember, this isn't just about watching live surgery, it's about teaching you guys the truth of what's happening in healthcare. And unfortunately, I can vouch for this 100%. The quality of doctors, the quality of their knowledge and experience and training has gone down tremendously worldwide. And that's for a variety of reasons. The truth is, if doctors are really good at diagnosing the source of symptoms, they're going to treat patients. Insurance companies don't want treatments. They want people to just go out and smoke marijuana and hopefully not use their insurance. Okay? Which is what a lot of people do. They do narcotics, they do painkillers like THC, which are not covered by insurance companies anymore, or they never were. There's been a big push in the States for pain management with marijuana, medical marijuana. And most people don't get it. Medical marijuana is not paid for by insurance companies, so you have to pay out of your own pocket. It's expensive over time because you're on marijuana, right? And you're paying for it out of your own pocket because the insurance isn't paying. The insurance companies have pulled a fast one on the American public. They basically convinced you all that pain medicine that they had to pay for, like narcotics, was bad for you, which it is, by the way, and that you should go and just do marijuana. They said opioid pain meds are dangerous and bad, which they are. You shouldn't be taking them. But, oh, by the way, let's legalize marijuana for pain. And that's what they did at the same time. They legalized marijuana in all these states, plus they illegalized narcotics, which are painkillers. They're brilliant. So they basically took away from you a medicine they pay for, and they gave you a medicine they don't pay for. And they did this right in front of everybody, and nobody's figured it out except me. And I've been trying to tell people about it for the last 10 years, what they're doing. And nobody's listened. They're just basically transferring the cost of medical care to your pocket from theirs. And they're getting richer and richer and richer every day by not paying for what you need. Now, surgery is another one of those things. And microdiscectomy is a surgery I never do anymore. Even if a patient asks me to do it, I won't do it. I won't. It's too destructive and it doesn't work well. I'm just not going to do something I don't believe in. So I'm sorry you had a microdiscectomy. I hope you come to Duke Spine so we can help you. Hopefully you have a fixable problem. I hope it's your piriformis. That's easy. We can fix that quite nicely in about 10 minutes. We're going to be doing that for this patient in about 10 minutes. And you can watch. Now, we are going to fix her piriformis and we're going to fix her SI. But to do that, I have to end the stream, and we're going to come back in just a minute with a bilateral sacroiliac joint rhizotomy, followed by a bilateral piriformis muscle release. This is probably the worst herniation of all of them. Look how much herniation there is. It's kind of falling apart, but it's also a newer herniation. It's not an older one. And that's why it's so friable, what we call friable. That's the term we use in medicine. Are you understanding what Luis is telling you, Nikki? So this is a friable herniation. Look at all the pieces. It's just not coming out in one piece. It's taking so many pieces, unfortunately. See, what happens with these herniations is over time, the body scars all these pieces together to make one piece. And then it's a lot easier to get out. But when they're newer herniations like this one, they don't scar together yet. No, I don't need the laser. I need the grabber still. Let me try the laser.
We have a few more questions.
I'll take them.
Next one coming from Rich on YouTube.
Hi, Rich.
Saying,
Welcome.
good morning, Doc and team. What lung issues are associated with laminectomy and or discectomy?
What issues?
Lung.
What?
Lungs.
Lung?
Lungs, like breathing.
L-U-N-G.
Lung. L-U-N-G, correct.
Oh. Wow. I don't know. To be honest, I don't know what kind of... Well, I know that, but I don't know what kind of question. If he's asking if the surgery itself damages the lungs, because the surgery itself should never damage the lungs. But, I mean, ever. But you could have some type of respiratory complication from the anesthesia. And you could also have, there's so many things that are possible. You can have an embolism, venous embolism. You can get a blood clot in your leg or your arm that goes up to your lungs and causes shortness of breath, and you can die from it. If it's big enough, it'll stop your circulation. You could have fat bone marrow embolization. If they release too much bone marrow into your bloodstream, which is, I've never seen that, but you know, nowadays with the surgeons being as bad as they are, all bets are off, you know. It's called bone marrow embolization. You can have fat embolization, where you get all this fat cells that go through your circulation to your lungs, and they affect your ability to exchange gases. And you can have retaining CO2 and failure to get enough oxygen. So there's so many possibilities. You can have atelectasis, as Dr. Berndes mentioned, where after surgery your alveoli are not opening and expanding because you're not getting enough breath, enough oxygen or air in your lungs to expand them. So you have collapsed alveoli, which then can lead to pneumonia. It's another problem with the lungs. There's too many to name. We don't ever have those problems with these surgeries that we do. All right, I've got about a minute left on this disc, and then we're going to end the stream. We're going to go to her sacroiliac joint DPR, and then we're going to finish with one last surgery, the piriformis. Any last questions for this live stream?
Yes. These last two questions are coming from Mike, once more on YouTube.
Hello, Mike.
Asking Dr. Duke, can annular tears with broad base bulge or budge at L4, L5 irritate or affect the L5 sensor or motor function?
Yes. Yeah, of course. Large herniations at L4-5 can definitely pinch the L5 nerve root. It's a given. They can also pinch the S1 nerve root and affect the S1 nerve root. What you really need to do, though, is stop trying to diagnose your own problem. Have Dr. Duke Majan do it for you, and then get fixed properly here at Duke Spine, rather than wasting your time and money and possibly your life getting treated elsewhere.
Next question they're asking Mike once more, asking, can you reach an entire disc from one side? If not, how far past midline of a disc? Thank you for your educational videos and live streams. I've learned a lot and want to learn more.
Great. Yeah, thank you. So the answer is 50. Midline is about as far as we can go, but it really depends on the disc. If it's thoracic, we cannot even get to midline. Usually, if it's L5-S1, we cannot get to midline. But every other disc, we can pretty much get to midline. Grab her. All right. I think we're done here. Just one more peek. This is it. This was definitely the worst of the four, and I'm glad we went back and took care of it. You can see the fibers of the PLL. We're outside the disc right now, just cleaning up the last of the herniation that's outside the disc, that's in the foramen. This is lateral in the foramen towards where the root goes after it leaves. There's a lot of scar tissue there, calcium. You can see it, golden color. White color for scar, golden for calcium, golden orange. Yeah, we're done. All right, we're going to end the stream and we're going to move on to her sacroiliac joints next. Remember, she travels all the way from Utah. She's been in a wheelchair now for over a year. She cannot walk because her back pain is so bad and her legs are so weak. We're going to be unpinching the nerves to her legs right now. That's what we just did. And next we're going to be treating her back pain, which is coming from SI and piriformis.